follow developments about the new Republican health care plan. There is a major update on a health care story that I first started investigating for Nightly News about 3 years ago. It's about Medicare patients that go to the hospital and have no clue that they could end up paying massive bills for rehab services. And it all comes down to two words in the fine print. 3 years ago, Congressman Lloyd Doggett of Texas saw our reporting, and his office says it inspired him to take on this issue. So on Wednesday, a new law went into effect that makes sure that these people in the hospital know about the issue.
This is for the internet.
3 years after breaking her leg, MJ Briku is struggling financially and still feels taken advantage of.
I was mugged. I think that's an appropriate word to use, you know.
Good.
MJ was stuck with $28,000 in rehab bills that Medicare would not cover. Why? When she went to the hospital, her doctor categorized her as being under observation. Her chart did not call her an inpatient, even though she was in the hospital for 3 days.
I just wish that they would do something to make it fairer for the people like myself that got caught in this.
For the 55 million Americans with Medicare, nursing facility rehab services are covered only if the patient receives hospital care as an inpatient for 3 consecutive days. Even more frustrating, patients have not always been told whether they're considered inpatient or under observation. That changes as of today, says patient advocate Judy Stein.
What changes now?
For the first time, the federal government is mandating, requiring all hospitals to tell people if they're in outpatient observation status.
That means verbal and written notification, but there is still a catch.
So a doctor could now tell you, Kate, you're under observation status, but can you do anything about it?
All you can do is complain and urge them to change that.
To fight back, she recommends ask if you'll need rehab, make your case while you're still in the hospital, talk to the hospital doctor, the discharge office, even enlist the help of your personal physician. MJ is now dependent on Medicaid, unsure if she'll ever get out of debt.
I don't buy anything personally for myself. Basically, I just pay off my bills and try to pay off my debt.
Some members of Congress are pursuing more action to address this head on, not just to let people know about the problem, but to actually try to fix it. And I want to bring in Democratic Congressman Joe Courtney of Connecticut. He's one of those moving on this. In fact, you just introduced new legislation, Congressman. Can we take a step back for a second? Where does this problem come from in the first place? Is it because of the Medicare rules?
Yes. I mean, if you really go back in time, the rules of the road under Medicare was always that if a patient was in hospital 3 days, was discharged in a doctor medically prescribed rehab, that was it. You qualified for Medicare coverage. Again, the under observation coding is a more recent phenomenon, probably over the last 10 years or so. It was sort of an auditing initiative by the government to make sure that people actually were being billed under the proper level of Medicare Part A versus Medicare Part B. But the problem is, as your story really hits hard, is that the patient gets caught in that coding audit procedure. And Lloyd Doggett's bill is very good in terms of
that's the one
providing
informing
some help.
people. Yeah.
That's correct. Connecticut's had that law for a number of years, New York and other states. But as Judy Stein said, unfortunately, that really is not always the solution. In fact, in most cases, it's not. A lot of patients, when they get the notification, aren't really sure what that means until it's too late, or as Judy said, in many instances, the hospital refuses to change the coding, so you're still caught in that limbo.
Yeah, and we heard from a lot of doctors last night, I did, on Twitter, saying that their hands are tied too. You've just reintroduced a bill that would try to fix this. Medicare, I should note, didn't answer our question about why this problem exists. They didn't really want to give us a statement on that, but they might argue that if you get rid of this situation that you're trying to get, what you're trying to do, that it actually could cost taxpayers money, right? Because Medicare is saving money right now by charging, people like MJ.
So again, as I said, my bill simply restores the 3-day rule, period. It basically says if you're in a hospital 3 days, regardless of whether you're coded under observation or inpatient, it should not matter that, your coding will somehow interfere with Medicare covering your medically prescribed coverage after you leave. Again, that's what's in law right now in terms of Medicare. The change, which some in the CMS claims saves the government money, I frankly think is really questionable, because what we're seeing in a lot of instances is that patients don't get rehab and they end up just recycling back into hospital because of a broken hip that wasn't rehabbed, or a congestive heart condition, et cetera. So, but the bottom line is that what my bill seeks to do, and it's a bipartisan bill, is just simply restore the 3-day rule, which goes back to 1965 when Medicare was first enacted.
Congressman Joe Courtney of Connecticut, really appreciate